Hello and welcome to the micro lecture. When I record lectures, I try to keep them under 15 minutes, so here we go. This particular lecture covers maternal, infant, and child health, otherwise known as MIC. And one of the things that I want you to I'm not going to go through all this in its entirety, but what I want you to kind of be aware of is the services and the opportunity, let's just stick with services that are connected to maternal, infant, and child health. And there's so much research out there regarding this particular topic, and I would encourage you to kind of pursue it. I know most of you are thinking about going into peds, so this is a perfect little lecture to think about. So what it is, I'm not going to go through the whole statistics, but one of the things that it is, it's a racial disparity. There tends to be the Black, Brown community and Hispanic community tend to have a high mortality and morbidity rates. So it's important to kind of know where to get that data, and the CDC and the NIH both have information on this, and not only the NIH or the CDC, but the AHRQ, which is the American Health Care Research Quarterly. So with that said, I want you to explore by clicking on this little globe and look at those mortality rates by race throughout the country, and you're going to see what that means. Okay, and then what I want you to think about is, how do we deal with that mortality rate, right? So we talk a little bit about productive health, looking at how we nurture and support, and what do those services look like. And there's so many services. We could probably do an activity just on this alone. So research indicators, just a couple. Unmarried women are more likely than married women to experience negative birth outcomes, like low birth weight, problems giving birth, not having the resources that are necessary to have good prenatal care, are just a few examples. Teen births are still an issue in our country, and teen mothers are more likely to have certain health behavior factors as well. They smoke. They don't typically get good prenatal care. They tend to have preterm births. And what's interesting, again, is how we don't have those services for these individuals. And I want you to kind of think about, or maybe even research on your own, what services may be out there. So just to continue a couple more, again, some of them live in poverty. And so again, and then they drop out of high school or drop out of school altogether. And so that also, remember we talked about how having a roof over your head and talking about how money and having a job really play a factor in public health, right? So if that happens, then it creates a trickle-down effect, if you will. Family planning is another thing that we take a look at, and there's so many non-governmental organizations out there. And I would encourage you to kind of look through, maybe do a quick Google search and find out which ones are maybe in your hometown. And we would have done this in class, but again, take a peek into that. That might help you out. So unintended pregnancies. Now this data is a bit old, and I'm going to provide some resources for you to kind of look at this issue. And take a look at the delayed prenatal care, the inadequate weight gain, smoking, alcohol, drug use tend to be those negative health behaviors associated with unintended pregnancies. Title 10 Family Planning Act, I would really like for you to kind of go through this and just kind of know it. Do you have to memorize it? No, because you can always look it up. But the aim is to reduce unintended pregnancies by providing those services and better planning. And then the data here too, I meant to look this up and change that number, so I apologize, but we are spending more on that because there's also a lot more connected to drug use with regards to having unintended pregnancies. As a matter of fact, I'm going to stop the lecture here for just a moment and look it up. Though I didn't look up the Medicaid dollars, I did look up just the economic analysis that shows how much went into this particular topic, and it was $12 billion. $12 billion went into this issue, and taking a look at why this is of importance. You know what? I'm going to just share the link with you. Here it is. Hopefully you can see it. I don't know if you can see it, and hopefully you can. But I would encourage you to take a look at this particular website and take a look at what's out there with regards to services and information and what is needed. Okay. Going on. So we talk a little bit about this one. We know that this one has changed due to legislation. I would encourage you to look this up. So just so you have a knowledge of it. I mean, the data changes all the time. The data changes yearly. So it's not important to really know the numbers behind it, but maybe just know the policy behind it. Okay. And then we have maternal health. And what does that look like? And maternal health is a pretty hot topic too, because we look at how that plays into the health of the child. So think about what type of health indicators are connected to maternal health. Now, as an FYI, there's a really good website, and I'll put that resource out there too, but between 2016 and 2020, which we would cover this in class, there is a link. Hopefully this will work. You can see, oh good, hopefully you can see it. You can see the states, and you can actually go to Michigan, and then you can see some of the analysis of the prevalence, remember what prevalence is, and the risks and assessments with regards to this. And so we can see this has actually been on the rise. So kind of keep that in mind, okay? And there's 2 pages here. Do you have to memorize this? No, but know where you can get it, okay? So knowing that you can get that information by going to the CDC and looking at the data on maternal and child health indicators. Cool? Yeah. Okay, great. And then again, prenatal health. Less likely to give birth to low birth weights if you have good prenatal health. And what are some of the things that we can do to kind of ensure better prenatal health? And then this is kind of basically hot off the press. Taking a look at the racial disparities of prenatal care. But there are so many resources. How do we collect all those resources to ensure that we give good prenatal care, or we actually provide services to those in need so that they can have healthy babies, right? So infant health is another thing that we need to kind of take a look into. And what does that look like? And do you need to memorize all this? No. But think about, the scale of immunizations and the nutrition that an infant might need, and good quality delivery as well. And so looking at those aspects of it. We have infant mortality, again, not necessarily needing you to memorize the data, but there is new updated information, and a lot has to do with the advances of clinical care. So I'm just going to highlight, turn this like this right here. Oops. Oh well. Okay, so improving the health. If you click on this, it should take you there. And here's the Boston Hospital. We'll put it in here and what you need to know. Again, just know what the risk factors are, what some of the services that are out there, and how much how much we are looking into making sure we don't have this issue, or we decrease this particular infant health issue. Okay, going back, what does it look like for child health? Again, we're looking at child immunizations, again, child care, doctor visits, and the like, is something that I want you to kind of think about. And then child mortality. I thought that this is interesting. Unintentional injuries cause a leading cause of death in children. And this has been helped right here, motor vehicle deaths, because of child care seats, right? And they actually the height and age has actually changed so that we have less childhood mortality in motor vehicles, but not wearing seat. But we're now finding that there's bicycle issues and kids not wearing bicycle helmets. That's a pet peeve of mine, by the way. Anyway, and then we have morbidity. What we're finding out with childhood morbidity is the emotional pieces of it and the mental health pieces of it is impactful. And then we also have food insecurity of childhood morbidity. We take a look at programs, and we could Google a ton of programs and talk about this for quite some time. But there are over, I think there's more than that now, more federal programs and the different agencies. And we can actually take a deep dive into all of the 16 different agencies. But for now, if you get a chance to Google it and think about how what programs may be in your local area, your local community that you could provide expertise to. And again, we don't want this to happen. Many fall through the cracks. How do we catch the individuals who are not getting those services? Then we have things like, Title V. I'm going to stop right here and get it. So if you get a chance, I would like for you to explore the Title V federal state partnerships. And then you can see here for child and maternal health, and you can see some of the data that's here, Pregnant Women 92. You can see where some of the allocations of federal funding went, what the regions are, and you can see the breakdowns. And this is just chalked. You could spend hours looking at stuff on this particular website. But for now, let's just take a look at maybe Michigan. And then there's the data that this is the funding that went there. Who's in charge of the Women and Children's Health Director? Who's that person? You can see here all of this information. So these are potential places where you could actually work. And then if you click on the go to state data, and here you go. We could be here for hours just looking at information. But the fact remains that there's information out here, and this is what it is. And if you get a chance, go ahead and go through it and learn about it's a key source of supporting and promoting and improving health of women and children, or mothers and children. So anyway, that's something to take a look and explore on. Again, there are tons of programs out there. Most of you probably heard of the WIC program. That's, through the USDA. It's been there forever. Again, we're looking, this data is old. I probably should pull up better data, but there's more than that. Participants, due to the fact that we've had so many changes in our society, COVID played a huge factor in upping this number. So keep that in mind. So WIC enrollees, if you get a chance, take a look at this WIC data information. I think it's going to be worthwhile. Providing insurance, we got CHIP. Hopefully link still works. Yay! Okay, so children's health insurance programs. What does that look like? We could spend hours looking at this policy. Actually, you can spend an entire class looking on children's health insurance programs and policy. An entire course, actually. So kind of keep that in mind. Going back, providing childcare. Childcare is so expensive. So we could be at that forever. Other advocates for children, take a look at some of these organizations. I think you'll find them worthwhile on how we advocate for children's health and welfare. And again, as you ponder, what are ways community programs can increase participation in prenatal services? I'm actually going to put this into an Edpuzzle, and I'd like for you to give your feedback. So hopefully you have that, and I'm going to end here.